Today I will tell you about viruses that kill immunity and how to fight them. The most dangerous virus that kills immunity is the human immunodeficiency virus. But today we will not talk about it. We will talk about the Epstein-Barr virus, cytomegalovirus, and the herpes virus of the 6th type, as well as how to fight these evil enemies. Probably each of you has heard about this trio and these viruses which are often found in humans. But what do I want to tell you today? If we're talking about a sharp process, that is, for example, if a child or an adult gets this infection for the first time and it proceeds as an acute condition, then, as a rule, if the immune system works well, they gradually cope with it, and the infection rarely becomes chronic. Therefore, the standards that still exist say that these viruses do not require special treatment and only symptomatic therapy is prescribed. But it's a completely different situation when, for example, these viruses are excreted from the mucous membranes of a frequently ill child. Their viral DNA is detected. In such a case, the viruses are constantly located in the lymphoid tissue, disrupt the work of the local immunity, and this condition requires correction and treatment regardless of the outdated standards. Old textbooks tell us that these infections are not dangerous and practically nothing needs to be done with them if they occur without any symptoms. But my experience in treating frequently ill children, together with good immunologists, says that when these infections are detected and appropriate good antiviral therapy is prescribed, as well as using other principles of treating this pathology, children subsequently stop getting sick or get sick much less after treatment. Most often for diagnosis, they use the determination of antibodies to the above-mentioned infections. These are antibodies, old antibodies, and antibodies that are formed during primary infection. But not always these tests can help us determine the chronic and latent course of this infection, because old antibodies, for example, are not. We typically say that the patient was previously infected with this virus but is no longer in the acute phase of the infection. However, this may not actually be true. In chronic latent flow, there may be old antibodies and there may no longer be fresh antibodies. Therefore, I consider the most relevant method at the moment to be PCR research with a swab with the mucous membrane of the throat. Most often we take a swab from the tonsils. We can also examine saliva for viral DNA for these infections. Ideally, you can even conduct 2 studies with an interval of 7 to 14 days. That is, let's say, took a swab. If the infection is not detected, you can repeat this study in 7 to 14 days to confirm the result. Taking a PCR test for these infections in the morning on an empty stomach is crucial. You can even avoid brushing your teeth before this examination. Let's talk in simple terms and plain language about the reasons that can lead to the fact that Epstein-Barr virus, cytomegalovirus, and herpes virus type 6 can have latent, hidden, and chronic course. The viruses themselves are Epstein-Barr virus, cytomegalovirus, and herpes virus type 6. They are very tropic to the lymphoid tissue, and they themselves can disrupt the work of the immune system. Therefore, a vicious circle is created. There is an infection that disrupts the work of the immune system, which creates conditions for this infection to thrive, and the further it goes, the worse it gets. Therefore, one of the directions of treatment is directly fighting this infection and directly prescribing antiviral drugs to which these viruses are sensitive. The source of inflammation in the upper respiratory tract leads to a disruption of the immune system's work, and conditions are created for the aforementioned viruses to freely fill inside cells and freely move between these cells, infecting the neighbors. That's why it's very important to identify the source of inflammation. In children from 2 to 6 years old, it is most often located in the adenoids, where the nose transitions to the throat. In adults, the inflammatory process is most often hidden in the glands, in the tonsils. That's why it's very important to treat the foci of inflammation in order to comprehensively fight the aforementioned trio. Very often, especially in children, the cause of recurring viral infections is inadequate immune response along the allergic pathway. That is, hidden allergic processes, for example, to inhaled allergens such as allergic rhinitis to dust, allergic rhinitis to animal dander, and so on. These are the conditions that can lead to our immune system, instead of slowly dealing with viruses when detected, to liquidate them. Practically unnoticed, it starts to explode grenades, it starts to work along the allergic path, causing an excessive inflammation, swelling, and an excessive reaction of the mucous membranes of the immune system. But if it helped the immune system to fight viruses, it would be good. But everything is different. Conditions are created that contribute to the virus being in the mucous membranes for a long time. But specifically about our topic today, it is located in the lymphoid tissue of our respiratory tract. Let's go further. The stomach can affect the mucous lining of the upper respiratory tract. If there are refluxes from the stomach into the esophagus, this irritates the mucous membrane and can trigger inflammation foci. Especially in children, these are the aforementioned adenoids and tonsils. In adults, it is mainly the mucous membrane of the throat and, in particular, inflammation in the palatine tonsils. Therefore, if you have heartburn, belching, night cough, a feeling of a lump in the throat, be sure to consult a gastroenterologist to rule out gastroesophageal reflux disease. Also, the local immunity can be affected by insufficient function of the thyroid gland, so-called hypothyroidism. Therefore, if you are dealing with this problem and have already ruled out the first, second, third are being treated and it's not going well, then you should definitely rule that out too. More precisely, check the function of the thyroid gland and make sure everything is in order there. Also, problems related to vitamin 500 deficiency are very much in the spotlight now. Indeed, a large part of our country is located in the northern regions, and we get little sun. Therefore, it is necessary, especially for frequently ill children and adults, to take vitamin on a regular basis during the winter period. Taking a vitamin helps improve the function of the local immune system and the overall immune system, and it also has a positive effect on other organs. The next reason is the secondary immunodeficient condition. These are disruptions in certain areas of the immune system's work, which begin to contribute to the virus freely moving in the intercellular fluid. And the immune system either doesn't see it there or can't process it and deal with it. And all this creates conditions for the infection to have a latent and chronic course. As mentioned earlier, the herpes virus infection itself can disrupt the immune system's function. But there are also a host of other problems and causes that affect the functioning of the immune system. Therefore, when a chronic herpes virus infection is detected, you should definitely consult with good immunologists who can help you diagnose, establish or rule out secondary immunodeficiency and correct the functioning of the immune system. The next reason is the conditions of our life and our environment. And if you think that bad conditions like cold, humidity, dirt, and so on negatively affect the work of our immune system, you are mistaken. On the contrary, too good conditions, too hot air, too hot heating, good conditions, warm windows lead to the fact that our air becomes too overheated and dried out. This leads to the fact that the mucous membranes of our respiratory tract begin to dry out. Therefore, the work of the local immunity is disrupted. This also creates conditions for the viruses we are talking about today to stay in our mucous membranes and lymphoid organs for a long time. We have a vegetative nervous system that controls many organs and systems. It controls the work of the heart, the work of breathing, the work of the intestines, and so on. Many functions. So it turns out to be our computer that controls many functions of our body, especially the work of internal organs. And our psyche's work affects the work of the vegetative nervous system. Therefore, if we experience constant stress, constant emotional strain, it begins to directly affect the vegetative nervous system, disrupting its function, which secondarily leads to various problems in organs and systems, including the fact that inflammation foci appear, the work of the endocrine systems, the immune system is disrupted. And all this creates conditions, including for the chronic and latent course of viral infections of the herpes group, the above-mentioned cytomegalovirus, Epstein-Barr, and herpes 6. The principles of treating chronic latent hidden forms of Epstein-Barr virus, cytomegalovirus, and herpes virus type 6 infections stem from their causes, which we just discussed with you. Let's discuss this. How does the virus exist and multiply outside the cells? A virus is just a set of molecules, but when it gets into a cell, it starts to multiply inside the cells using intracellular structures. And our cell puts all its proteins which are inside on the surface. If the immune system sees a foreign protein, it begins to destroy these cells. But with chronic herpes virus infection, the immune system may not notice this virus in the cells, and therefore it can be there for a long time. But from the intercellular environment, for example, if there are antibodies, then this virus can be removed by the immune system. Therefore, it is very important when detecting chronic infections of the above-mentioned viruses to prescribe antiviral drugs for a long time, because they will be removing this virus from the intercellular environment. They will contribute to the slowing down of the multiplication inside the cells. But the life cycle of cells has a certain time, so if we prescribe antiviral drugs for a short period of time, we have only temporarily slowed it down. But then everything returns to its cycle and the virus begins to multiply again. Therefore, courses of antiviral treatment should be no less than 30 days to achieve a good effect and sufficient result. What medications do we use? Everything is very individual, and it is better to select a treatment scheme with an immunologist. In my practice, I really like to use the drugs isoprenosine. But again, everything is individual, there are contraindications, so please consult with specialists. The next direction is the identification of disorders and correction of the immune system's work. Unfortunately, we cannot deal with this on our own. That's why it's necessary to connect a good immunologist who knows how to deal with these infections, knows how to identify secondary immunodeficiency, knows how to correct the work of the immune system in order to cope with these infections. Therefore, read reviews, look for good specialists who know how to do this. Because if you've come to an immunologist and he tells you, yes, fine, no problem, I'll prescribe you an antiviral drug for 5 days and everything will be fine, this likely isn't what's required. Because as experience shows, to deal with these problems, to deal with this chronic latent infection, and to correct the work of the immune system usually takes from 3 to 6 months. The next direction is the treatment of inflammation foci. If we identify signs of adenoiditis in children, signs of tonsillitis in adults, then we prescribe complex treatment for this problem. I'm not going to talk about how this is done now because it's not something you can explain in 1 or 2 minutes. But there are videos on this topic, and here, right now, links to these videos will appear, which you can watch additionally. When inflammation foci are detected, they need to be treated together with an otolaryngologist. Let's move on. If a large amount of conditional pathogenic or pathogenic flora, which can support the inflammatory process, is sown in the brains on the flora that you passed, and there are signs, including of the bacterial inflammatory process in the foci of inflammation, then we need to reduce the number of these bacteria. But we rarely prescribe systemic antibacterial drugs, because in addition to reducing the amount of pathogenic flora, they also reduce the amount of our own natural normal flora. And then space is freed up for herpes viruses, which will find it easier to survive. That's why we only use local antibacterial drugs, or bacteriophages which kill harmful microbes, or local antiseptics. We also prescribe courses of sanatorium therapy, that is washing, irrigation, courses of cuckoo, this is washing of the nose and nasopharynx, courses of washing the nasal sinuses if there is a focus of inflammation in the glands. That is, our task is to reduce the amount of pathogenic, conditionally pathogenic flora, if there is one. When identifying pathology of surrounding organs and systems, when identifying reflux disease, it is necessary to deal with this problem. If there are signs of inflammation from the side of the nasal sinuses, this should also be dealt with by otolaryngologists. If you are not taking a vitamin, you must do this if this infection is detected, and the vitamin will contribute to the improvement of the immune system's work, and it will work better, including the antiviral immunity. The next step is to create conditions for the normal operation of the local immunity. This is creating in your dwellings and in your homes a normal temperature of 20 to 24 degrees Celsius and good humidity, which will ensure normal moisture of the mucous membrane of your respiratory tract. This is a humidity of 50 to 60%. If your batteries are boiling and you have a fever, cover them. If they don't cover them with clothes, blankets to lower the temperature in your homes. We increase the humidity with the help of air humidifiers. Besides everything else, we can moisten the upper respiratory tract in an artificial way. This is the use of sprays with seawater and physiological solution, which can be poured into some kind of spray bottle. We moisten the nasal mucosa in the morning, in the evening with 1 or 2 sprays into each nostril. Also, if there is particularly dryness in the throat, we can do inhalations with the same physiological solution or mineral salt, for example, 17-essentuki. To moisturize, including the lower respiratory tract to better activate the local immune system. If there is a lot of stress in your life, if you have a child with special needs, if he often throws tantrums, if he has any problems with work, mental health, he is constantly stressed, tantrums, some kind of dissatisfaction, insomnia and other conditions, that is the peculiarities of the child's work, the psyche, then be sure to turn to specialists, to psychologists who can cope with these difficulties. It's not always fast, it's not always easy, but nonetheless, you need to move in this direction. And you need to achieve a comfortable level of existence for you as parents, comfortable upbringing of your child, create good conditions for the proper development of your child, to minimize stress and reduce the impact on the immune system to the maximum. And then everything will be fine. Take care of your health properly. I wish you health. See you. Bye.